She's been the face of Toronto's pandemic response since the first case landed. I recently sat down for a one-on-one with the city's medical officer of health, Dr. Eileen Davila, to discuss an unprecedented year. And in true 2020 fashion, we met virtually. I'm going to start with the most important question, maybe. How are you?
Well, it's been a long year. I will say 2020 has been full of challenges. An unprecedented situation with a global pandemic, brand new virus, one that we needed to respond to while we were actually learning about the virus itself and how it's transmitted and how best to control and prevent its spread at the same time, which is no question a very, very challenging thing to do. I would say that I've seen the remarkable resilience of my team at Toronto Public Health. And I would also say that I've seen remarkable resilience and strength on the part of the residents of Toronto themselves.
When you are trying your best and you see the anti-mask rallies and you see what happened in Etobicoke with that restaurant owner, you see conspiracy theorists, does it frustrate you? Does it make you sad?
No, they don't make me happy, obviously. It's always concerning when I see people out and about, clearly not isolating or not limiting their social interactions. This is part and parcel of what it is to live in a democracy. We know that we have to support the free exchange of ideas. And I think really what it speaks to is an opportunity for us, whether it's within the realm of public health or just government writ large, to actually recognize that there are segments of our community with whom we need to engage better.
In October, as the spread of the coronavirus grew worse, Davila strongly recommended to the province stricter restrictions in Toronto, which were beyond her powers to enforce. The province did not act on those recommendations until 7 days later. There began a debate, with some experts arguing that local medical officers should be given the legal authority and resources to make those decisions on their own. Shouldn't medical officers of health be more empowered to make the decisions rather than waiting for the province to do that?
I think fundamentally, again, as I said before, what it comes down to is what were the goals of the response and how best do we achieve those goals? We're always going to have some slight differentials given that we sit in slightly different seats. But the important point is let's make sure we bring our different strengths together.
The pandemic has put a spotlight on health officials like never before and has often resulted in many being subjected to harassment, racism, and even death threats. Davila says she too has been a target.
Certainly, I've had my share of detractors, people who haven't agreed with what course of action we've taken. If I know and I can look back at my work and say, with my colleagues at Toronto Public Health and beyond, we've used the best available science. We've relied on our data. We've looked at the experiences of other jurisdictions. Then I can rest easy and sleep at night.